So hello and welcome. My name is Mona and I'm the Marketing Communications Manager at Working Culture. Thank you for joining another WorkSmarts webinar. WorkSmarts is a Working Culture series that teaches skills related to organizational capacity and management. And in today's webinar, we will be learning about how and when to reopen your arts and culture office. This session would not be possible without the support of Ontario Arts Council and Music Publishers Canada. And we would especially like to thank Music Publishers Canada for sponsoring this webinar. And a little bit about Working Culture. So next slide, please. Yeah, that's great. We are a nonprofit arts service organization that supports artists, creatives, and cultural workers across Canada. And though our office is in Toronto, the traditional territory of the Mississaugas of New Credit First Nation, the Haudenosaunee, the Huron-Wendat, we acknowledge and appreciate that Canada is home to many diverse Indigenous peoples. And we hope to continue serving and supporting all individuals and communities interested in working in culture. So most people recognize us for our job board, and that's where you can find all kinds of positions for artists, creatives, and cultural workers. However, we also have a wide variety of resources and professional development opportunities that you can find through our website, workingculture.ca. And if you'd like updates on any upcoming programs and webinars like our WorkSmarts webinars, please do sign up to our newsletter and you'll get updates there, or you can follow us through our social media accounts like Instagram, Twitter, and Facebook, as well as LinkedIn. And note that this webinar is being recorded and we will have it available through our YouTube channel as well. So you can share it with your peers or revisit it at any time. Now, before I invite Mike, our wonderful presenter, to present, I'm going to share a poll just to get a better idea of, what you're thinking about, how you're going to get back to the office, and be interested to see how people respond to these questions. And I'm sure, Mike, you might be touching on some of these questions in your presentation. We'll just give it a minute for everyone to review and answer these questions. Are you looking forward to getting back to the office? What do you think will be challenging when you're back to work in the office? And what are you looking forward to when you're back in the office? That's great. So and are you able to see the results? I'm not sure, Mike, can you see these results as they're coming in? Or do I have to share that?
I think I actually probably should do the poll and then I might be able to see the results.
Oh, people are answering the poll right now.
Oh, okay, great.
I'm doing that. Yeah, no, I think, okay. So we have 15 people in the room and we have about half the people have answered. I think everyone has answered. Okay, great. So I will share the results so you can see. All right, so it looks like people are looking forward to getting back to the office. That's great. Some people are not sure yet. And what do you think will be challenging when you're back to work in the office? Staying healthy for sure. Yeah. New office dynamics. Okay. And what are you looking forward to when you're back in the office? So a lot of people are interested in socializing again in person with coworkers. So that's wonderful. And so I'm going to stop sharing and introduce you to our wonderful presenter, Mike Rudolph. He is a a human resources leader with experience working in for-profit and nonprofit organizations, including the Toronto International Film Festival. He is currently the people lead for a Toronto-based solar energy company and is a certified human resources professional. So thank you so much, Mike, for presenting today.
Thank you so much, and thank you for that welcome. So hi, everybody. My name is Mike. My pronouns are he, him. And yeah, I'm really excited to talk to you about this topic that I'm sure is front of mind for so many people. I also want to preface this by saying the tools and the processes that I'm going to talk about in this presentation are all things that I've actually done. These are the resources and the things that I followed when deciding how to open our office. And just to give you some context about what kind of a company I work for, we're just over 50 people and we have an office in downtown Toronto. So hopefully, we're not a massive, thousands of people. It's similar sizes to, I'm sure, some of the organizations that you work for. I also want to say too that some of this does touch on legal issues and things like terminations as well. I just want to stay off the top that, I am not a lawyer. None of this is actual legal advice. These are just things that I've put together as far as best practices. So, when dealing with anything that you think could be, I really recommend that people reach out to your legal counsel, and I'll touch on this a few times. So for the agenda, it's kind of a packed agenda. So I want to talk about how to plan for your return to the office, the COVID-19 requirements that you have to do as part of opening your office. I'll touch on another, a very hot button issue, which is around mandatory vaccine policies. And then at the end, I'll talk about supporting employees in the hybrid world. So I think, based on the poll, health and safety is really number one for a lot of people, and health and safety is going to be a big through line throughout this presentation. But then also this new work dynamic that people talked about, that'll definitely be covered in the fourth section. I also want to say too, if you have any questions about some of the slides, feel free to unmute yourself and ask them. I would love this to be kind of a flowing conversation, especially if I use kind of HR speak. If someone wants to clarify a term or something, please feel free. I also want to leave some time at the end to do some questions. So if it's maybe more of a general question, please save it for the time at the end. Okay, so, and I think I touched on this already, but just our learning objectives for this meeting. So at the end of this webinar, you should be able to, design your return to office plan, know the COVID requirements for working in the office, understand what's needed for a mandatory vaccination policy, and identify ways that you can support your employees working in a hybrid model. All right, planning the return. So I wanted to start off with a statement from the CEO of Siemens, and Siemens is a large multinational corporation, much larger than probably any of the organizations that we're working for right now in this webinar. But the reason why I wanted to touch on this statement is that I think it's really heartening to hear a CEO of such a large company talk about what the future of work looks like. And maybe I'll just read it. So the basis for this forward-looking working model is further development of our corporate culture. These changes will also be associated with a different leadership style, one that focuses on outcomes rather than the time spent at the office. We trust our employees and empower them to shape their work themselves so that they can achieve their best possible results. With a new way of working, we're motivating our employees while improving their company's performance capabilities and sharpening Siemens' profile as a flexible and attractive employer. So a couple of the key things that you can see in this statement is that there's really this change, this shift to focusing on outcomes and not just hours spent on in the office, and also about trusting and empowering your employees. And the other part of this too that they talk about is this flexible and attractive employer. And I'm sure you've all heard about the great resignation of people quitting or moving on from their roles because of being in a post, or maybe not post-COVID world, but a later COVID world. And a lot of that has to do with not being flexible and not employers not adhering to the new way that the world is working. So I just kind of wanted to those key points, focus on outcomes, not hours, and trust and empower your employees as two things to keep in the back of your mind during this presentation. So when planning the return, the first thing you really need to do is evaluate what your office needs. And just because employees can return doesn't mean they want to return. And that's touching on what I was just saying about, what do people actually want in this future of work? I really, really suggest that everyone, if you haven't done so already, please put out a survey, ideally an anonymous survey, just to gauge interest. It's something that it's really helped our assumptions in my company when we decided about what a return to office looked like. And we assumed that people wanted to come in more often than they actually did, which is something that was really helpful to get out of the survey. So, people really said, I want to come in once or twice a week. I don't want to come in 2 to 3 times a week or 5 times a week. Your plan should also be flexible enough to accommodate both of those types of people. So there might be people who have a living situation where they're in a tiny apartment, they don't want to work from the same place where they sleep, and they would like to move into the office more frequently. And then there's some people who are like, I'm good just coming in once or twice a week, or maybe not even at all. It should also be clear that it's okay to defer the return. So especially with certain anxieties or stresses about being in this world, even if with vaccination policies and things like that, there is still a hesitation to immediately flip a switch and be back into the office 5 days a week. So if people need more time, and especially being more accommodating for people with childcare or other needs like that, we should make it clear that we're not forcing people to return to the office. And I think at the executive or management level, there should be a decision on who really needs to be in the office. So maybe there are certain teams or certain individuals who are going to be in the office more often than not. One thing I'd like to say here too is that there might be an instinct for the executive directors or higher ups to be, well, I have to be in the office 5 days a week. That's actually not a best practice, because if there's a perception that the executive director is in the office 5 days a week, there might be the perception might be that employees only have access to the higher ups or the managers if they are in the office that frequently as well. So as an executive director or leader in the organization, I actually recommend that you be in the office occasionally, but you don't automatically think, oh, because I'm a leader, I have to be in the office 5 days a week. It's actually more fair if you are working remotely sometimes as well. A few must-have measures, and a lot of this has to do with health and safety. And like I said, I'm going to be talking about a lot about health and safety in this presentation. So number one is think about reducing your shared touch points. So if you're in a meeting room, if you're using meeting rooms, keep doors open until after the meeting. Sorry, keep doors open after the meeting. Don't turn off lights in meeting rooms until the end of day. That way you're just reducing the places people are touching more frequently. Ensure that people keep a strict clean desk policy. So especially if you're hoteling or hot desking, people shouldn't be bringing personal items, pictures, knickknacks, that kind of stuff back to the office, just to make sure that they're cleaner. And also make sure that you have lots of disinfectants and wipes near meeting rooms and any other common areas. Protective equipment. I'm going to be talking about this a little bit later as well, but please provide face coverings, those disposable masks in case people forget them, and ensure that people wear them in all areas of the office except when they're in their individual workstation and able to socially distance. And reducing entry to workspace. So as much as possible, do contactless delivery. If people are getting deliveries like personal packages, people used to get Amazon boxes sent to our office all the time for personal items. That really should just be a no-go in the new world. And really limit the amount of visitors, especially personal visitors. I personally have been loving doing remote hiring and doing interviews via Zoom. So really consider what types of roles should you really bring into the office for hiring purposes. And maybe it's only in the last stage that you take them on a tour of the space, that's fine. But especially early on in the hiring process, really limit the amount of people that are coming in. And then, try to do as remote meetings as much as possible with third parties. Enforce physical distancing. So place stickers on or markers on the floor to make sure that people know like in the grocery store, which paths to take, reconfigure the desks. So maybe that's reducing capacity in order for them to have that 2 meters distance, and put up signage in the put up signage in the office about physical distancing. And unfortunately, it's probably best not to have any communal eating areas, at least not now. So I would say putting up, changing the if any communal eating areas, and just asking people to eat at their desks. Improving hygiene, touched on a lot of this already. So signage to clean services with increased cleaning, hand sanitation stations, and then of course follow any building instructions. So the buildings where your offices might be have specific instructions about disinfecting and things like that. And reduce the impact of exposure. So ensure that your sick day policy, if you haven't looked at it since COVID, ensure that it reflects the new working world. So if people are not feeling well, even if they kind of like iffy, encourage them to work remotely that day. And then also look at your remote working policies. And of course, this is something I'll be touching on, and you're required to do this, which is a questionnaire upon entering the office each day. And a tool that we're using, if your company uses Slack, a tool that we're using is called Officely, and I really, really recommend it. There's other ones like Envoy, but Officely is the tool that we're using for Slack, and it's really great. People can book desks and they just automatically get sent a survey. But I'm going to go into more details about the health questionnaire in a later section. So when you're thinking about your reduced office capacity, really what you have, it's just some simple math. So how many people can fit in your office? It's basically the amount of workstations that you can keep at 6 feet apart, or 2 meters, and any offices or meeting rooms that can be repurposed. So I recommend, if you do have a few offices or meeting rooms, probably not having that big board meeting in person anytime soon, repurpose them and maybe have those as individual rooms that people can book. And so when you combine those two, the workstations and the office meeting rooms, if you're repurposing them, that will be your maximum capacity with social distancing. Another way, so some other ways you can manage this reduced capacity. So you could do alternating occupancies. So maybe there's one group that works Monday and Wednesdays, and that can be team specific. So the marketing team and the development team come in on Mondays and Wednesdays, and then 2 other groups come in Tuesdays and Thursdays. Or maybe you have alternating weeks. So kind of like back and I remember in high school, I think I had we had different weeks in first classes. So you could do it that way as well. You could do shifts. So maybe it's half days that this one group comes in, and half day another group comes in, or staggered work hours. Some people work 8 to 4, some people work 9 to 5, and some people work 10 to 6. That is also great for people who have to take into consideration, childcare and other things like that. So staggering work hours and kind of getting out of this 9 to 5 mentality, or just being flexible is recommended. And so what we're doing in my company is hoteling and hot desking. Basically what that does is you have a set limit of how many people can book a day, going back to that capacity, calculation. And then you can use an online sign-up sheet like a Google form, or maybe it's just a shared Excel doc that says which people are coming in which day, and people can sign up. Or you can use an app like Officely, like I mentioned. The key thing here is ensuring a cleaning protocol is in place. So really, if people are sharing desks, and I don't recommend people share desks in the same day. So if someone has booked one desk, that's their desk for that entire day. Making sure that you have a cleaning protocol in place. So wipes and cleaning supplies are on hand. And of course, whatever regular cleaning services you have, it's probably good to up that if you're doing hoteling and hot desking. I'm going to move on to COVID-19 requirements, unless there's any questions about anything that I talked about when trying to figure out the future of what the office looks like.
Hi, I have a question. Can you hear me?
Mm-hmm. Yes, I can hear you.
Now, I don't know if now is a good time or maybe at the end. I just wonder, what people are thinking in terms of if it becomes hybrid or people prefer to stay working from home, what are people doing in terms of providing for your employees? Like, what about internet? What about a workstation? What about a laptop?
Yeah,
Are there guidelines? You know, what are thoughts around that? I don't know if you want to cover that now or if that's going to get covered.
I think let's maybe I'll put a pin in that, because I'm going to talk about hybrid work at the end. So yeah, that's a great question. But I think let's bring that up in the Q&A at the end. But I'll make sure to remember that.
That's right. Thanks.
Okay, let's talk about specifically COVID-19 requirements. So as an employer, you have to ensure that you're complying with 3 major acts during COVID-19. 2 of these you might be familiar with, which is the Occupation and Health and Safety Act, or the OHSA, and then the Employment Standards Act, which is the ESA. The newer one is the Reopening Ontario Act, and this is where these COVID-19 specific requirements come in. I'm going to talk about the 2 major things you're going to have to do as part of the Reopening Ontario Act. But I also just want to stress that when making any of these decisions, here I am talking about health and safety again. Remember that the #1 priority is the health and safety of your employees, your volunteers, your customers, and any other stakeholders, not just coming into the office, but just whoever you're engaged with. So really, this is where your health and safety lens has to. But in many places, your health and safety lens have to be viewed through. So I think I've already kind of addressed this in the previous section, but quick 2 answers to top level questions. Do we have to physical distance in the office? Yes, you do have to physically distance in the office. Do you have to wear masks when you can't physically distance? Yes, you do have to wear masks when you can't physically distance. And I know you're thinking, but restaurants are open. I sat at a table with my family at a restaurant last weekend. No masks, but when I'm in the office, you would have to do that. The answer is basically that workplaces have to ensure that people can maintain a physical distance at 2 meters. And when they're not in common areas or cannot maintain a physical distance, such as passing each other in the hallway or going into common areas like kitchens, they must wear a mask. So it's just about keeping our employees and stakeholders safe. So it is different from, yes, going to the restaurant, going to see a movie in the theater, working out at a gym. They are different requirements. And as part of the Reopening Ontario Act, all employers must have 2 specific things: a screening, and this is if you want to open the office, a screening questionnaire and a COVID-19 safety plan. So I'm going to talk about the screening questionnaire first, because I'm sure we're all fairly familiar about what this looks like if you've gone to a restaurant or gone to any events in the past couple of months. So a screening questionnaire must be completed by all employees, including vaccinated ones, if they wish to enter the office. And you have to do it each time that they want to enter the office. You can do this verbally. So, at the gym that I go to, they just kind of ask 4 questions and you just go, nope, nope, nope. It can also be a survey that they fill out ahead of time. And that can be created as easily through like a Google form or a SurveyMonkey. And I've done it with a Google form. And it's great because the answers are then kept on file. And they're easily exportable if we need to do any contact tracing or anything like that. And there's also a screening tool from the government of Ontario. So what this is basically a website that people can go to and answer those questions, and it'll say that they've passed the screening questionnaire. So if you don't want to make one yourself, you're more than able to use that one from the government of Ontario. The survey can be sent to them before they come in or as soon as they enter. So if they don't fill it out ahead of time, they can do it as soon as they come into the office. And of course, probably better to do it before in case they don't pass the survey. And the survey also must be completed by any visitors who wish to enter the office. So going back to maybe if you're bringing candidates in as part of the hiring process, they would have to do the screening questionnaire. If an employee or visitor fails the questionnaire, they must not be allowed in the office. And you must keep a record of the dates and times that all employees were in the office for at least a month for contact tracing. And this is where I'll plug Google Forms again. you don't have to worry about it. It automatically gets put into a Google Sheet where you can, and so you won't have to worry about keeping it for a month because it's just going to automatically be there until we don't have to use it anymore. So highly recommend using some sort of online form as well. I'll just go over the questions quickly because I'm sure people are familiar with them. But the questions are you currently experiencing any of these symptoms? And choose any and all that are new, worsening, and not related to any known causes or conditions you already have. And then there's a list of questions. And of course, what we're looking for is none of the above. Have you traveled outside of Canada in the past 14 days and have been advised to quarantine as per federal quarantine requirements? So this is a slightly different version of an older question. So I think the question before was just, have you traveled outside of Canada in the past 14 days? The addition here is this and have been advised to quarantine. So if people are traveling outside of Canada and not vaccinated, that's when they would have to quarantine. So if you have traveled outside of Canada and you haven't been told to quarantine, you can answer no to that question. Has a doctor, healthcare provider, or public health unit told you you should be currently isolating, or also known as staying at home? We're looking for no here as well. In the last 10 days, have you been identified as a close contact with someone who currently has COVID-19? In the last 10 days, have you received a COVID alert exposure on your cell phone? And in the last 10 days, have you tested positive on a rapid antigen test or home-based self-testing kit? And then is anyone you live with currently experiencing any new COVID-19 symptoms and or waiting for test results after experiencing symptoms? Yeah, so if the screening is passed, they can enter the workplace. And then of course, you still have to maintain any COVID-19 health protocols like social distancing and masking. If the screening is not passed, they must not enter the workplace, and they should self-isolate and contact their healthcare provider. So that's the screening questionnaire. The second thing that you would have to do as part of this process is a safety plan. So all workplaces are required to develop a COVID-19 safety plan. The plan must detail the steps you're going to take to reduce the risk of COVID-19, including screening, physical distancing, and masks. Be available to staff to review and for anyone who asks. So making it available for staff to review could be sending it out over an email, posting it in the workplace, maybe adding it to any handbook or employee manual that you might have. And then, yeah, the last one is being posted in a visible place in the office. The safety plan must include how you will educate employees on how to keep themselves safe from COVID-19, screen for COVID-19, control the risk of transmission, deal with any potential cases of COVID-19, and to deal with a potential case of COVID-19 in the workplace, and also ensure that your plan is working. So I'm going to go through actually step by step each of these different sections and how you can develop your plan. One thing I will say is there is not, at least I haven't found, like, even though all the plans have to basically cover the same information, there's not like a government supplied template or here's a doc where you can just kind of plug in your workplace and the specific things you're going to be doing. What I've included, and I have a list of resources at the end of this session, is actually the City of Toronto one is pretty good. I've looked at the government, like a lot of the different ones that we send up from the government, and the City of Toronto one is actually my favorite, and it's basically a checklist. You still have to kind of write it yourself, but I like a checklist. I like a checklist, but I also find it's also helpful just to go through step by step and seeing what's applicable to my organization and what's not. Because a lot of the things, as you can probably guess, are not designed for our organization's smaller cultural organizations. They're looking at things like manufacturing plants and these giant campuses that people are working in, not offices of let's say 10 to 20 people. But I really like the City of Toronto one. And again, there's a link at the bottom there, and I'll supply a list of links at the end of the session as well. So the first section is around education. So how will you promote health and educate people about what to do and for how to reduce COVID-19 in the workplace? So you can put up things that I do in my organization is put up posters about hand sanitizing and sneezing into the elbow. Promote vaccinations. So as an employee, I know it's always a bit of a question of like, are we actually able to talk about vaccines in the workplace? yes, you can promote vaccinations. You can send out things about maybe if there's information about booster shots or stuff like that coming down the pipeline, you can definitely promote that in the workplace. And then remind employees of specific policies that can protect them. So remote work, sick days, any health benefits that we have, mental health supports, also any maybe leave of absences if people need to take care of a family member, stuff like that. Maybe reminding people of those different policies that you might have as well. The sections about screening measures, we've already covered it. Great, check that off the checklist. So basically all you have to do is just write what we've already talked about, which is we'll be screening everybody. Here are the, we'll be asking them questions. We will keep their information for a month and, ensure that only people who pass the screening test or the screening questions are entered into the workplace. So yes, we've already done one. And then we've also already talked about this too. So we're really ahead of the game here. So controlling the risk of transmission, physical distancing, you can talk about how you're setting up the desks, repurposing offices, not taking down taking down any communal lunch spaces, masking when not physical distancing. You can talk about supplying masks in case people forget them, and then cleaning surfaces and talk about your different the cleaning protocols and everything that we've already talked about. And so this is an important section as well that we haven't talked about, is what happens when there's a potential exposure of COVID-19 in the workplace. So the steps that you would have to do is exclude the person from the workplace. So if they don't pass the screening questionnaire, or if they, if you're inviting them into the office for a meeting and they say, actually, I'm not feeling well, make sure that you're excluding that person from the workplace and not letting them into the office. They should contact public health, but you also have a duty to contact public health as well. And you also might have to, I get that in a second actually. So, and the public health will let you know what to do, especially if there was an exposure in the office. So you might have to notify people who would have been exposed, which is why you need to keep those records for at least a month of people who have passed the screening questionnaire, so that you can understand who was in the office at the same time, also known as contact tracing. You should shut down the office immediately and make sure that make sure that it's deep cleaned, and of course let the cleaning company know that the reason behind it so that they can prepare themselves as well. And you also have to report it to the labor and possibly to the Workplace Safety Insurance Board, the WSIB. And public health will let you know if you need what steps to do exactly, but those are definitely the three major ones. To ensure that, so the next section was around ensure the plan is working. So regular check-ins with the Joint Health and Safety Committee, if you have one. Organizations who are less than 20 people do not need to have a Joint Health and Safety Committee. Doesn't mean you can't have a Joint Health and Safety Committee, but you do have, if you have, I think it's more than 10 people, you need to have at least a health, someone like, it's like a health advocate or someone who is in charge of health and safety. So either that person or the JHSC should be reviewing and checking in about the COVID-19 plan. Safety plan. Get feedback from employees. So understand, what's working, what's not working. How do they feel comfortable coming into the office, especially if you've had a suspected outbreak or exposure. Make sure that you're checking in with people and understanding that how they're feeling about coming back to the office. And if there is changes either from the government or either more restrictions or hopefully fewer restrictions in the future, update the plan and communicate any changes. And the communicate any changes is really important. And I'm going to talk about different communication channels in later in this session, but it's really important that we don't just think, okay, well, I've created a document and I'm just going to put it in a common area. We're done. Talk about your safety. Talk about what what you're doing and how you're going to keep people safe in many different aspects. Maybe it's a town hall. Maybe it's just in your one-on-ones. There's you save some time to ask any questions about coming into the office. But communication is I think it's impossible to over communicate in a situation like this. So think about your different channels of communications and how people can make sure that they feel safe and secure. So after the plan is complete, so after you've put all of those different sections together, share the plan with your employees. So there you go, talk about communication, make it available and post in your workplace, already talked about, and put it in your employee handbook as well, or any other documents where you would have people referencing different policies and things like that. I saw a question something come into the chat. So yeah, I'm going to move on to the mandatory vaccine policy. So this, as I said earlier, this is probably the most, or one of the most sensitive things we'll be talking about today. I really want to make sure that I stress again that, you know, it's probably whenever possible, you know, always check in with any legal counsel or any lawyers that your company or organization has in contact with, because it's really very specific to different companies, but or organizations. But to answer some kind of more general questions about mandatory vaccine policies, major question that I get asked all the time is, are we able to create a mandatory vaccine policy? The answer is yes. We, as mentioned earlier, we have a duty to protect our workers under the OHSA. And if we think that the best way to protect our workers is through a mandatory vaccine policy, then we're allowed to do it. Many organizations, I'm sure we've read about it in the news, mostly larger organizations, but many small organizations like mine, have implemented mandatory vaccine policies in their workplaces. It's frankly too early to tell what, if any, legal actions will arise out of such mandates. There's no government legislation for offices or workplaces. So again, similar to how there's specific rules around casinos and gyms and movie theaters, there's no government legislation around offices and workplaces, and also, like, of course, like healthcare and things like that, and federal offices there are, but just kind of our organizations, no government legislation. The Ontario Human Rights, I think I had tribunal, but I believe it's the Ontario Human Rights Council has released a statement. There's a link to this statement here. It's basically stating that that mandatory vaccine policies are, quote unquote, generally permissible. And the reason why that's important is because that's where people who would find these to be objectionable would go to. So the fact that the Ontario Human Rights Council are saying that it is generally permissible is a really good sign that there wouldn't probably be any legal actions that will be of any substantial manner. So we've established that, yes, mandatory vaccine policies are allowed in the workplace. The question really is, should you do it? Because it really depends on a number of factors. Number one is, how many people are you working in the office? So you know, if you're only having maybe one or two people working in the office at a time, you might not need a mandatory vaccine policy. The other question is, how many people have been vaccinated? And yes, you can ask people that. I would recommend doing a survey, an anonymous survey, and just saying, are you fully vaccinated? And you'll be able to define fully vaccinated however you like. But most people define it as having 2 doses. And are you working in an environment where your employees could be at risk? So are you working in the environment that has a lot of public touch points, or where people are traveling? You know, other ways that people could potentially be at higher risk of being exposed to COVID-19. So if those answers are, you know, if you have very few people working in the office, you know that everyone's been vaccinated, and you know, your employees are not at risk, maybe you don't need a formal vaccine policy in order to keep people safe, because they're already doing everything that you can to be safe. But you know, for my organization, we felt that it was important just to say, if you want to work from the office, you do need to have proof of vaccines. So how should you do it? Again, as I said earlier, you can't over communicate these things. So introduce it in a meeting, follow up in a formal policy, post those policies wherever you post them, and put them in employee handbooks, kind of the same system there. What should the policy include? Well, it should talk about why you're implementing it. So again, tying it back to the Ontario Health and Safety Act, and your duty as an employer to keep people safe. talk about when it's going to into effect. So ensure that you give people enough time to get their second dose and also clear those 2 weeks after the second dose. So maybe it's going into effect, Jan 1, 2022, or maybe it's going into effect if December 1st, if you're pretty sure that everyone already has their vaccines. And also, like I said earlier, define what you mean by what is fully vaccinated. Is it 2 shots? Boosters are fully super available right now, so maybe it is 2 shots, but maybe it'll be 2 shots and a booster in the near future. How will you keep the records private? So it's really important that there's one person who has access to this information and in a secure way. So for me, for my organization, it's me as the head of HR, that I'm the keeper of the vaccine records. So maybe it's the executive director, maybe it's an office manager that you have on your organization. Unlike when going into a restaurant or a gym, you can keep these in a secure personal file. So you only have to ask for proof of vaccination once. You don't have to ask it every time, like the way that you have to do the survey every time that someone wants to come into the office. And then here's the biggest one I'm sure that we all have is how will you respond to people who don't comply? And so I want to talk about accommodations really quickly. So there's 2 legitimate grounds for accommodations for people who cannot receive the vaccine. The first is a medical reason. And there's, from the research that I've done, and again, not a medical doctor, not a lawyer, but there's 2 major reasons why someone can't have the vaccine for medical purposes. One is an allergy, and the second one is a diagnosed episode of myocarditis or pericarditis after receiving their first dose. So this is a reaction, I think, to the first dose. Again, not a doctor. And this also needs to be supported by a letter from their employee's doctor. So again, they can't just say, oh, I have a medical reason. You have to get a letter, and the letter should say, this person cannot be vaccinated for these because of one of these 2 reasons. The other ground is under creed or religion. And now this would have to be based on religious beliefs. And it's not really clear what those exemptions would be, but it would have to be supported from a religious community and also like materials on the belief system. So basically, creed and religion is not personal preference. I've done my own research. That's not a creed or religion. A creed or religion is a legitimate, established, faith-based organization who is saying we do not believe in vaccines for these reasons, and they need to be supported by documentation and literature. And again, the Ontario Human Rights Commission has said that a person who chooses not to be vaccinated based on personal preferences does not have the right to an accommodation under the code. So there it is. And again, that's the body that people would go to basically fight a mandatory vaccine policy. So if they're saying that personal preference is not a religion or not enough for accommodation, that's fairly big and good support for vaccine policies. So what does an accommodation look like? An accommodation would look like, this is similar to accommodations if you're familiar with any of the, the Accessibility for Ontarians with Disability Act, the AODA. We have a duty to accommodate unto the point of undue hardship as employers. And what does undue hardship mean? It means basically everything up to the point of significant difficulty or expense. So an easy accommodation, if people cannot get vaccines for those legitimate reasons, medical or creed or religion, is that the employee stays working remotely. So until these, we don't need vaccine policies in the workplace, or until some more restrictions are lifted, or you do rapid testing, but before the employee enters the office. So each time they enter the office, they would have to take a rapid antigen test. Depending on the role, though, both of these could meet the threshold of undue hardship, by which I mean not all roles can be 100% remote due to the nature of the job. I was reading an article the other day about a healthcare worker and people working in long-term care facilities. Those aren't roles that can be done remotely. And if you can't get vaccinated and work in that and before a legitimate ground and you can't work remotely, that person might not be able to do their job or probably won't be able to do that job. And also rapid antigen testing is expensive. So it might be undue hardship for an employer to give rapid antigen tests every single time a person comes into the office. So again, this is really tricky, especially talking about accommodations. So if you feel like you've met the threshold of undue hardship due to an accommodation, before doing any actions, I'll talk about the actions in a second, please make sure you consult an employment or human rights lawyer and get their counsel on that. So if, let's just say, an employee refuses, you have a mandatory vaccine policy and an employee refuses to be vaccinated and does not have a legitimate ground of accommodation. So again, falling under that personal preference area, there's a few things you could do. You can issue a warning and make this as formal as possible, especially written down and saying, we require that you were working in the office. As part of this, you have to receive a vaccine, and you have until this date to comply. You can put them on unpaid leave, so there's no reason to continue to, if they're not meeting the thresholds that you've set out as the employer, there's no reason to keep paying them and maybe give them, I would say, a lot of time. That's why you want to give people that long, that as long as a runway as possible in order before the vaccine policy comes into place. And then yes, you can also move into a termination or dismissal. And that could actually be with cause or without cause, but it's really too early to tell if these will be upheld and not fought in the courts. But really, again, I'll stress before putting any of these into action, please ensure that your employees have all the information of the policy and like again, different channels of communication. Make sure that they don't have legitimate grounds for accommodation. So if somebody says, I'm not going to comply with this policy, ask them why, and make sure that they're not, that specific medical reason or under creed or religion, and has the time to get fully vaccinated as per the definition in your policy. So make sure that they have enough time in order to get those 2 shots and also the 2 weeks afterwards. Again, before doing any of these, please, broken record, please consult your legal counsel before any of these actions, especially before dismissal. You should always be, talking to legal counsel before dismissing anyone in general. That's just my 2 cents, but especially under these cases. I do want to stop there and ask if people have any questions, because I'm sure I covered a lot, and this is a sensitive topic, as I mentioned. Okay, I will move on to the last section and then, of course, open it up to the general Q&A. Okay, how to support employees in a hybrid world. So basically, you've probably heard this term hybrid work environment. What does that actually mean? Basically, if you have some people working in the office and some people working remotely, you will be considered a hybrid work environment. So due to the capacity restraints, you might not be able to have everyone working in the office at the same time. So some people might be in the office some days and other working remotely other days. That's a hybrid work environment. The principle behind working and supporting people in a hybrid work environment is that people and information should be available to everyone regardless of where they work. So this is kind of going back to what I was saying at the beginning of the session around making sure that people don't feel that they can only access their manager or the executive team in the office, physically in the office. So ensuring that if people aren't able to come into the workplace for whatever reason, they still feel that they have access to information, access and the same abilities to progress in their career and that kind of thing. And of course, here we go again. As stated earlier, we have to consider health and safety in these areas as well. So communication is key. Like I said, you cannot over communicate in a situation like this. So make sure that you're keeping your one-on-ones. And if you don't have regular one-on-ones, at least weekly with each of your direct reports, I highly recommend you do that. And I've also be thrilled to chat with anyone about how to do effective one-on-ones, especially remotely. That's a whole other hour unto itself. So maybe that's a different webinar altogether. But yeah, so please keep your one-on-ones and make sure that you are you're being fully present with them, with your direct reports. You should have team meetings, and maybe these are daily check-ins. Maybe that's a little overkill, but maybe it's a quick 15 minutes each morning at 10, just checking in and seeing how people are doing. Or maybe it's weekly or bi-weekly team meeting. And then also, thinking about all staff meetings or town halls. We do town halls. So pre-pandemic, we used to do town halls bi-weekly, and now we do town halls weekly. They're usually about 20 minutes to half an hour, not super, long, but the CEO really felt that it's important that the team the executive team sees me on a weekly basis to get updates and just talk about what's going on in the company. So consider doing them more frequently than you're probably doing them. If you use anything like Slack or Microsoft Teams or GChat, it's always great to update your availability in those chats. So saying when you're away from the desk or you're having lunch, just to make sure people know when you're accessible and when you're not. And the other thing I recommend is creating a channel map. And what a channel map is basically a way of understanding what level of communication is needed, or what type of communication is needed, what channel, for what type of urgency, and then what's the norm of responses. So if you send someone an email, this is for internal communication, but if you send someone an email internally, it's probably not that urgent, and you probably, and just saying the norm is, you'll get a response within a day. A Slack or a Teams GChat message, or even a text message on a cell phone, it might be a little, I said non-urgent because I didn't know what the difference is, but it's probably like slightly, it's not quite like, the something's on fire, but you're looking for something that you want to get at least a response to in an hour or so. And if there's urgent communication, that's when you pick up the phone, and it's an emergency. So and this is going to be different for different organizations. This is just an example, but having an outline of saying, here are the different ways that we communicate with each other, and this is when we use them, this is when you should be able to expect a response, is really helpful in a hybrid work environment. You should also consider meeting norms. So when working remotely, one thing that's really important is one person, one screen. So that what I mean by that is one person was remote. So if it's not a team meeting in everyone's in the same space, have everyone at their own camera, at their own computer for the meeting, so that there's not like a group of 2 or 3 people in an office that has poor audio, and then one person, working remotely and they can't understand or see each other, or feel like the people working in person are collaborating, and this person feels left out. So even if one person is remote, everyone should be at their computer as if everybody was remote. Encourage camera on. This is a tricky situation. Sometimes people don't want to have their cameras on, but maybe it's on those important team meetings. It helps with bonding and clarity. Maybe it's not needed for every meeting. And if it's a bigger meeting, start with an icebreaker, checking in with people, seeing how they're doing. And if it's a longer meeting, encourage breaks, allowing for people to stand up and take a break. Anything more than an hour, I would ensure you have just the ability for people to stretch. Health and safety considerations. So regardless of where you're working, either in the office or working remotely, any of your respectful workplace policies apply. And so of course that's, harassment, sexual harassment, violence in the workplace, AODA, any of those policies, workplace policies apply regardless of where people are working. The Joint Health and Safety Committee, as I mentioned earlier, it's only needed for organizations of 20 people or more, but doesn't mean that you can't have one if you are a smaller organization. Because a Joint Health and Safety Committee can help with the safety in the office and also safety working remotely and looking at ergonomics and things like that. The document that I'm going to share as a resource has a great section about ergonomics in the while working remotely, and where you should have your laptop and why a stand is important and what the eye level of the monitor should be. It's really helpful, and I would highly recommend checking out that document. Again, it's the link at the bottom and also at the references at the end. And then mental health supports. So I just make sure that you have benefits that support mental health practitioners, because people do feel isolated and lonely sometimes working remotely. If you have an employee assistance program, maybe consider doing mental health days. Flexible work arrangements, as I mentioned earlier, from maybe not the 9 to 5 is going to work for everybody. And then also look for non-work related activities, especially remote friendly ones. I am moving a little quickly because I realize it's 11:57. So I don't want to say that this is not important, but I do want to get to a couple of questions if possible. So as a key takeaway from this very long presentation, I just want to make sure that everyone knows that these are the kind of the 5 things that I want you to take away. Survey your staff, listen to what they want, and balance that what your organizations need. Ensure you have a screening questionnaire and a COVID safety plan. Implement a mandatory policy if that works for your organization. Accommodate if necessary for employees who have grounds for not getting vaccinated, and support your employees regardless of where they're working. Here are some resources. These are all the tools that I've used to develop this webinar and also used to develop our policies in my company itself. They're all really helpful and great. And I also want to end by saying, please feel free to reach out to me, answer questions. I'm happy to answer questions. You can connect with me on LinkedIn. But I do want to answer a couple questions now in the 2 minutes that we have remaining. And thank you for putting those in the chat, Mona, as well. So I'm sorry, the person who asked the question, was it Janine?
Yes, that was me. Hi.
Yes. Sorry, could you repeat the question? It was about what you should supply as far as internet policies and
yeah, exactly. Like internet policies, working from home. I think it's great that there are hybrid models, but what does it mean? And, just to hear what people are doing, or what are some guidelines, obviously
yeah,
you provide everything. Now, if in a hybrid situation, you provide it twice, I don't know, like obviously laptop and again, we are a very small organization.
exactly.
But just to understand, I know big organizations, have a budget of so much money that they can give people to buy things, but just to have an understanding, what are people doing, or maybe people have a creative solution.
So a couple of things that come to my mind is, yes, number one, it all depends on the organization and budgeting. And when you're looking at things like hybrid work environments, you're actually kind of in a way doubling your resources the cost of your resources, because you have people working on laptops at home, and then you're going to maybe have monitors and things in the office as well. So it's almost like you're having to have 2 offices for people. And so I would suggest that it really is about your own organization's budget. And then the other thing is, so for us, we did look at internet, because we do require people to have higher internet speeds, just the nature of the work that we do. So we figured out what that gap was between kind of regular internet and high speed internet, and we are paying the difference there. There's definitely things like some organizations I know are doing stipends, like maybe it's $100 a year or a certain amount each month to cover those costs. It is going to be dependent on each types of organizations, and you're right. There's probably a lot of creative solutions out there. The one thing I will say too is that the government, from a tax perspective, people are able to claim more of the expenses that they use for their home office. And I believe that'll be the same it was last year and this year as well. So even if you're not able to cover everything through the organization through budgetary constraints, they personally would be able to at least claim it on their taxes. But it's not a one size fits all kind of answer, I know.
Thank you.
A question from Kate. Are there any different responsibilities required by the ESA for staff that work remotely 100% and those are working from home occasionally? No, I mean, and so like I said, the policies are still the same regardless of people are, so the health and safety, AODA, all of those types of policies are the same. There are going to be potentially some changes coming down. I don't know if you read about when people can contact people beyond work hours. There might be a kind of a government legislation that says that we can't contact people after a certain time. I was just reading about that yesterday. But no, as far as the ESA is concerned, a remote worker and in-person worker or employee are essentially the same. They just might have different, like health and safety requirements at working in the office versus working remotely. Are there any pitfalls to extending accommodation to an unvaccinated employee, even if there are no legitimate grounds of accommodation? That's a great question. So I think if someone says I refuse to be vaccinated and they don't have a legitimate grounds you can still accommodate them, yes. It's really dependent on, like I said earlier, the type of role that they do. And yeah, so if people would prefer to just continue working remotely and you're okay with that person working remotely indefinitely, then I say, that's probably fine. As long as it's seen to be equal across the organization so that you're not making one exception for this person and saying everybody else has to be in full time. So whenever you're doing and that's why I was saying about the vaccination policy, you should make clear that it's only if you want to have them work in the office. So maybe that's how you make the differentiation. If you're allowing people to work remotely, then and they don't need to be vaccinated. If we have to be 2 meters apart in the office, should we also be 2 meters apart when a meeting table or having in-person meetings? Yes. So it's either 2 meters apart in the meeting rooms, probably better in meeting rooms because the ventilation is probably not as good. I would recommend, actually, even if you are 2 meters apart, being masked in a meeting room for in-person meetings. Great. Well, I know it's over time. I just want to thank everybody again for for attending, and please feel free to reach out to me. I'm happy to chat and talk about this type of stuff or anything. You can feel free to reach out to me.
Thank you so much, Mike. That was so helpful. And yeah, maybe we'd have to bring you on for another webinar because there's so much to cover.
Yeah, I'd love that.
Yeah, thanks everyone for joining. And as mentioned earlier, this will be available for you to revisit and share with your peers through our YouTube channel. Thanks so much, everyone. Have a great rest of the week.
Bye, everybody.
Bye.